Welcome to Final BDS MADC. With this video, I'll be starting to post commonly asked university questions of first year subjects. So let's begin with the 7-marker question, which is describe development of face and add a note on its developmental defect. So beginning with the development of the face, it begins in the 4th week of intrauterine life and continues until the 10th week. It involves contributions from the frontonasal process, maxillary processes and mandibular processes, which are derived from the first pharyngeal arch. The facial structures are formed through the complex interaction of these processes. Coming to the processes involved in facial development, first one is the frontonasal process. It forms the forehead, bridge of the nose, medial and lateral nasal processes and part of the upper lip. Next are the maxillary processes, which are paired. They arise from the first pharyngeal arch, form the lateral parts of the upper lip, cheeks and most of the hard palate. Next are the mandibular processes, which are also paired. They also arise from the first pharyngeal arch and they are used to form the lower lip, chin and lower jaw. About the stages of facial development. In the 4th week, formation of the stomodium begins, which is also called the primitive mouth, and frontonasal, maxillary and mandibular processes appear around the stomodium. In the 5th week, nasal plug cords appear on the frontonasal process and invaginate to form nasal pits. Medial and lateral nasal processes surround these pits. From 6th to 8th week, medial nasal processes merge to form the intermaxillary segment, which contributes to the philtrum of the upper lip, the primary palate and the upper jaw central part. Maxillary processes grow medially to fuse with the medial nasal processes, forming the lateral parts of the upper lip and cheeks. From 9th to 10th week, final fusion of processes occur to form the definitive face. Talking about the developmental defects of the face, any disruption in the fusion or growth of facial processes leads to congenital anomalies. Common developmental defects include cleft lip and cleft palate, failure of fusion of the maxillary process with the medial nasal process. They may present as unilateral or bilateral. Second one is oblique facial cleft. It occurs due to failure of fusion between the maxillary process and the lateral nasal process. Third one is the median cleft lip. It occurs due to failure of fusion between the two medial nasal processes. Fourth one is mandibular hypoplasia. It occurs due to incomplete development of the mandibular processes. And last one is frontonasal dysplasia. It occurs due to overgrowth or malformation of the frontonasal process, leading to wide set eyes, also called hypertelorism, and a broad nasal bridge. That's it. Thank you for watching. If you like this video, do hit the like button, share it with your friends and please subscribe to my YouTube channel. Stay tuned for more such videos.